Hello, my name is Anne. I am a mummy of 3 little people and a doula, UK doula. And a few years ago I set up the Facebook page and group Dispelling Breastfeeding Myths. And normally I write blogs, but at the moment it's kind of hard to use both hands at the same time. So rather than take weeks to write a blog, I thought maybe I'd just do a video to talk about the topic I wanted to write about, which is our recent trip across to England for a tongue tie release. This is my little boy. He is 6 months old now. He was 23 weeks when we went across to England, and I live, as you can probably tell, in Northern Ireland. I have 3 children, as I said, and all 3 of my kids have had some degree of oral restriction. My eldest, who was my great teacher in all these things, hasn't had a release. My second girl did have a very successful laser release a few years ago, again in England, and I've been across to England with all 3 of them for various things. When I recently posted a picture of the quite dramatic change in my son's latch after his release, lots of people said to me, why didn't you just have it done down the road? Why didn't you stay in Northern Ireland and go to XYZ? And so I wanted to explain a little bit about why I chose to go across the water, and also why I think that that decision was the right one in terms of his care. Hopefully it'll make some people think, because as far as I'm concerned, and I have 6 years of living and breathing tongue tie and learning about it, so although I'm not a breastfeeding counsellor or an IBCLC, I am a doula who's supported a lot of women with breastfeeding, and I'm a mummy of 3 breastfed children, all of whom, as I said, have had some sort of tie. So I've looked into this a lot, and so hopefully some of my thoughts will be useful to other people who are navigating their own tongue tie maze. Yes, so why didn't I stay in Northern Ireland? Well, during my previous experiences across in England, I learned a lot about how the tongue affects other parts of your body. So it's not just as simple as snipping a frenulum. In some cases it might just be as simple as snipping a frenulum, and that's fine. The baby's in perfect working order, and it solves the problem, and there's no breastfeeding problem, and blah blah blah. Great, if that's the case, great. But in a lot of cases it's a little bit more complicated than that. So a tongue that doesn't move well might be not moving well because there's a frenulum that's preventing it from moving well. It might also not be moving well because the baby's got stacks of tension in its neck or elsewhere in its body, possibly from pre-birth in the womb, its time in the womb, or possibly because of the way it was born, and maybe interventions, or maybe a von-2s or a forceps, or even just lying badly. And birth is quite a a tough experience in a little baby's body, and so they often come out into the world carrying some tensions. And so I'm a great believer in body work. My son was very lucky because of my experiences with my other children. I knew to take him for body work quite early, so he had chiropractic care, and he also had craniosacral therapy with a great practitioner over here. And I wasn't sure when he was born if he had a tongue tie or a tongue restriction, as I think I prefer to call them tongue restrictions. But so I thought I'd just watch and wait and see, and I'm quite experienced at feeding babies that don't latch particularly well. So he did fine, and he gained weight, but he was full of wind, completely full of wind, very uncomfortable. I couldn't get him to tilt his head back to latch on, I couldn't understand why that was. Despite all the body work that we were still getting a lot of wind, and he was still unable to tilt his head back. So feeding, although it wouldn't have looked to anyone outside like there was a problem, I was confident that we were having some problems that we could improve on. Now it might be if I'd only wanted to breastfeed for 6 months, you might have ignored it, but having fed for longer than 6 months a child who had a tongue restriction, once teeth come along, things change again, and there are no guarantees that all the compensating that the child's been doing up to that point is going to continue to work. So I decided it would be good to try and get it sorted out, or at least assessed properly before his teeth started to come in. So on my previous experiences with tongue tie, I've had some really fantastic support from Charlotte Young, who runs Milk Matters. She's a lactation consultant across in England. And I've also had support from other people. My friend Carol, who used to be a DBM admin, helped me a lot. But ultimately there was nobody really I could go to here, because you've got a lovely big chubby baby, and people aren't really, you know, that interested. In fact, it's very rare to get people really diagnosing tongue ties effectively here. And if they are diagnosed, as I'll go on to explain, I'm not convinced that they're being thoroughly treated. I've supported a number of women who've had tongue tie releases in Northern Ireland, some of whom, you know, no benefit. It didn't really seem to improve anything. The baby still couldn't behave, you know, breastfeed normally. There was no lactation support whatsoever, and there was certainly no mention of body work. So the reason I think those things are important is because the tongue is a muscle that's attached to a bone in your throat, the hyoid bone, and much in the same way that you have sails rigging on a ship. All these things are interconnected. So a restriction in one part of your body might affect your tongue function. Again, the tongue function might affect, you know, restrictions in other parts of your body. So it's not just as simple as kind of just looking at the tongue and going, oh yes, snip, and away you go. I personally believe that it's more involved than that. And in order to get a really full release and the most benefit out of the procedure, which is a surgical procedure carrying small level of risk, you know, it's important to set the ground as carefully as you can. Now, I know that costs money, and nobody has a lot of money these days, but just speaking personally, I felt that if we were going to do it, we were going to do it 100% right. And unfortunately, in Northern Ireland currently, we don't have an integrated practice where you can work with people who are aware of all of these interactions between the body, the tongue, and breastfeeding support. And those three things for me are very interconnected. You can't really separate them out if you're going to do it properly. And so we travelled across to England by plane again, my third journey across to Huddersfield, and I was beautifully looked after and doulaed by my good friend Nikki Mather, who helps me on the group. And she was fabulous. She picked me up, she drove me about, she took me across to Huddersfield and held my hand while Lou had his tongue tie released. I have to say that the care we got over there was excellent, absolutely brilliant, as I expected. We had cranial osteopathy with Tracy Lomax from Huddersfield Osteopathy First, and she is just a total goddess. She is magic. I don't know how she does what she does, but she's, you know, beyond compare as far as I'm concerned, and we're very lucky that we have somebody who's working in this integrated way. And Tracy's very used to working with babies with all sorts of restrictions, and tongue tie being one of those things. So she set him up very nicely, and he had already been quite well set up before, but she kind of finished the job. And then he had a full assessment from Charlotte, and we went into the breastfeeding history, and because we'd been in contact anyway before that, but you know, we did it right first. A full assessment, find the offending tie and restriction, frenulum, whatever you want to call it, and I decided not to be with him when he had it snipped. I wanted to come to the rescue afterwards. Just my personal choice. I know other mums are quite, you know, they want to be there and holding their baby, but for me it was important that I came to the rescue. So they took him off, swaddled him. I went to the loo. By the time I got out of the loo, they were back, and he fed straight away. He had no bleeding. He cried because he didn't like being swaddled, but he cries when he goes in the sling, so you know it was the same. He didn't appear to be in any pain. There was no bleeding. He latched on beautifully, and a much deeper latch, and this time his chin was right in close, his head was tilted back, and it was obvious that, you know, the tension was creating a problem with breastfeeding. You know, it's not brain surgery that you need your tongue to breastfeed, but as far as I'm concerned, a breastfeeding problem is a kind of red flag for other problems potentially. You know, if you want to go away and Google the consequences of untreated tongue ties, they're fairly extensive, and you don't just use your tongue to talk and breastfeed, you use it in lots of other ways too. It's crucial to chewing your food properly, it's crucial to all kinds of things, and so optimal function of the tongue in a baby seems a sensible thing if you're setting somebody up for a life of optimal tongue function. I wish that more people could appreciate just the importance of getting it right for mummies who want to breastfeed, and also in terms of that child's longer term health, the way their teeth and their face develops as they get older, and it's all connected. So those were the reasons why I chose to take a trip across to England, which, you know, cost us money, but I have to say that without the support of those people it would have been an awful lot more stressful than it was. He didn't seem to have an awful lot of pain afterwards at all. he has fed very well since. He sat up 3 days later. Whether that's a coincidence or not, I don't know, but he was certainly in very good shape in terms of his body. He's nice and relaxed, as you can see. He's a very chilled out little chap, and he's in good, very good working order now, so he's a very lucky little boy. And I just wish that those things were available to other mums, that kind of support. It's very easy to be dismissed. It's very easy to think that somebody else is an expert, but I urge my clients that I work with as a doula to listen to their instincts, and I urge all mummies to listen to their instincts. I urge anybody who's supporting women with breastfeeding problems, and that includes those people who are revising tongue ties, to really think about the big picture. Think about the fact that breastfeeding is a relationship between a mummy and a baby. You need to nurture that relationship and support it before, during and after any surgical procedure. And let's not dismiss the impact that even a small snip can have, for better or worse, on that relationship. So hopefully my story will explain a little bit about where I feel we're lacking in Northern Ireland. Getting a tie diagnosed at all is hard enough, never mind getting it properly snipped. I have a few photographs that I'm going to put up at the end just to show you some of the trip and the outcome. And if you are looking for support with maybe a tense baby or something you're not sure about, please get good breastfeeding support. Find a local body worker who understands the implications of a restriction in somebody's mouth, and ask on the groups online for recommendations, because that's the best way to find the right person. And I hope this has been helpful. Thanks for watching.